I'm Dan Tsai. I'm your health director here in San Francisco. I'm also joined by Dr. Christy Soran, who's the deputy medical director for substance use treatment here in San Francisco. It's as per usual, going to go through our the latest monthly overdose numbers, overdose death numbers here in San Francisco, and talk about a few highly pertinent things and a piece of awareness we want to flag for everybody. So, in the month of May 2026, we had 35 overdose deaths. 35 is the second lowest month on record since the Office of the Chief Medical Examiner started tracking these numbers in 2020. The lowest month on record was last month, April of 2026, where we had 34 overdose deaths, and the other lowest month was October of this past year, where we also had 35 overdose deaths. That 35, for context, is a 40% decrease from the same month last year. Last year, May of 2025, we had close to 2 overdose deaths a day, 58 for the month of May. We are at 35 for May of this year. Year to date, January through May, we have had 219 overdose deaths. Compared to last year at this time, that is 30% less. So I want to emphasize, those of you that are here often, you've heard me say this every single time. I'm pleased by the trajectory of these numbers. And 5 months into the year, we still have 219 overdose deaths. That is 219 too many overdose deaths. Every overdose death here in San Francisco is preventable. It's unacceptable. So even while I am quite pleased that we are continuing to make progress, the work is far, far, far from done. And we are going to highlight and note, again, a particular public service awareness piece in a sec, and I'll turn it shortly to Dr. Christy Soran. But I also want to note, just to recap some of the things that we've been doing. There is no one silver bullet that will solve this crisis, this public health crisis we have. It is a multifaceted piece. As a city, we have been tackling things in that way. That includes expanding access to treatment and clinical services very rapidly. Last month, we had our clinical team and also some of our peer navigators in the streets till 3 a.m. in the morning with an organization called Code TL, Code Tenderloin, where we're out there in the streets engaging with folks and quickly getting access for folks up until, the wee hours of the morning, access to medications for their opioid use disorder that both reduce the risk of overdose and actually get people on a path of treatment and help connect them into services for recovery. We've seen a straight line up in terms of the number of new clients, patients, people we're able to serve, many straight from the street, who at that moment raise their hand and are ready to take a step forward in their journey of treatment and recovery. And we know in that moment, we have to be ready with options to get them connected to care. So I'm very proud of the progress that the team has made. Dr. Christy Soran and many others across the department and other partners in the community have really helped to drive that. And we're nowhere near done. There's still times of day in the evening and the weekend when folks want access to treatment and have clinical needs, and we need to be able to get folks into care more quickly. It should be in San Francisco. If you are ready for treatment and recovery and you raise your hand, we can get you to options immediately. And so we've made tremendous progress on that. Our budget at DPH continues to increase investments in behavioral health and substance use disorder and mental health supports. That is great. And we have more work to do around that. So again, second lowest month on record since 2020 for overdose deaths. That is progress. And we continue to have much to do. What I want to shift to now before passing it to Dr. Christy Soran is earlier this spring, we noted that the Office of the Chief Medical Examiner had identified a particular overdose death with a younger individual from a counterfeit pill where there was a novel synthetic opioid product called cyclorphine was identified that is much more potent than fentanyl and was the first time that we had seen it here in a recorded overdose death here in San Francisco. And the main piece to emphasize there is to continue to have folks have awareness, especially younger individuals, that any counterfeit pill could lead to an overdose death. And we're, this one is not safe. I got a question. How many? None. And so we want to continue to make sure there's awareness of that. And Dr. Christy and Soran and team have been engaging educators and others throughout the community. We want to make sure if anyone sees this, people are aware. So I'm going to turn it to Dr. Soran now. Thank you.
Thank you, Director Tsai. I am Dr. Christy Soran, the Medical Director for Substance Use Services with the Department of Public Health. This spring, we learned of a fatal overdose that was caused by 2 novel synthetic opioids that are more powerful than fentanyl that were contained in a counterfeit pill, which prompted our health alert 2 months ago. These synthetic opioids, N-propionitrile also known as cyclorphine, and N-decyl isotonitazine, have been implicated in a small number of overdose deaths across the nation, but this was the first time that we saw these substances present here in San Francisco. I want to reiterate that counterfeit pills are any pills that are illicitly manufactured outside of legal regulated channels. They can look like legitimate pills. They can look like Xanax, Adderall, oxycodone, but contain a number of different substances, and you cannot tell by the look, the smell, the taste of what's contained in these substances, and puts people at risk of overdose. We also know from national data that young people are more likely to use pills or counterfeit pills and are more likely to experience overdose related to counterfeit pills. We also know that some people access these pills through social media. They're advertised through social media and quickly directed to unregulated channels on the internet to purchase substances such as these pills or other illicit substances. Because of this, DPH issued a webinar a couple months ago, primarily focused for San Francisco educators across the city to be aware about these opioids, about counterfeit pills, and what to do to prevent overdoses. This is in addition to ongoing work we've done with 5 different community-based organizations that are really focused on youth prevention interventions across the city. Young people need fact-based information about drugs to counter the information that they get from friends or social media, and they need trusted adults in their life to talk about drugs in an honest way. We want young people, their families, educators, and anyone working with youth to be equipped with the knowledge and tools to save lives. And I want to highlight 3 key points to take away. The first is, as Director Tsai stated, the safest choice is to abstain from drugs. Really, this is the only guaranteed prevention method, is to not use drugs, not use pills, and only use pills that are prescribed to you by a clinician. Still, despite our guidance and our best hopes, we understand some young adults will continue to encounter or experiment with drug use. So second, we want people to know that how to recognize an overdose and to use naloxone, also known as Narcan, which can reverse an overdose and is available over the counter. When given in a timely manner, it reverses the overdose to all opioids, including these 2 novel opioids that were present. If anyone's concerned about an overdose, regardless of what substance, giving naloxone is the right answer and getting 911 support. The third thing we want people to know is that there is help for youth who are struggling with substance use. Treatment is effective and available, and we're here to support you. Here in San Francisco, we have specialized youth treatment available. We contract with the Homeless Children's Network, which is a provider that's deeply experienced in providing trauma-informed behavioral health care and has youth-specific treatment available. They provide a spectrum of outpatient treatment, including early intervention, which is a treatment focused on youth at risk of developing addiction, and intensive outpatient and outpatient treatment for people with more severe substance use disorders. Additionally, later this year, we will be opening a youth-focused residential treatment facility here in San Francisco in partnership with the Latino Commission called Casa Lil Hawk. This program will be one of a handful in the state of California that are specialized youth-focused residential treatment. We want everyone to know that support is here. Families and youth can talk to their doctor and can seek out our DPH programs for help. Thank you.
Thank you, Dr. Soran. So with that, we'll see if anyone has any questions. Natalia?
Yeah, the mayor's office released its reset numbers last week, and I just wanted to see if you could comment on the senator's role protocol is at the center of everything?
Sure, and I just want to reiterate the Reset Center is a contract held by the Sheriff's Department. It's not part of DPH's budget. Our clinicians, because we also run jail health, have been very involved on the clinical care components to help make sure that anyone that is taken to the Reset Center has the best clinical support possible. So our team has been very engaged in that. Our clinicians would say we would much rather care for somebody or help care for somebody not in a jail context. And in that sense, you have nurses, social workers, and peer supports around that. We have, and our team is engaged on the back end to help connect people to care and treatment. We have been, uh, I don't know what the number of connections to treatment has been higher than we expected with folks. Once they are situated, comfortable, there's a peer navigator to help really engage them. We are having greater success in getting people plugged into treatment and care. That is everything from residential treatment programs to a range of other DPH programs of the sort that Dr. Soran has talked about to help people get started on medication and other supports. All of those things are critical in a path of treatment and recovery for folks on the street.
So I have a question about these overdose deaths. Does DPH have specific numbers, and were you able to identify who these people were, maybe connect with the families and things like that?
You're talking about overall, so
The new drops.
oh, yeah. So I want to again thank the Office of the Chief Medical Examiner, who every month provides a very, very detailed report of every fatal overdose in the city, as well as which substances are found in conjunction with that death. And so in April, we announced that we found the first case, and is the only case I'm aware of to date, where there was a fatal overdose in San Francisco, and these novel synthetic opioids, particularly cyclorphine, was identified. So it is one case, but we are taking it extremely seriously because we know of the risk of counterfeit pill usage with youth, and we are wanting to make sure that all youth, educators, families have full awareness of the dangers here, as well as the options and support that youth have available. And this applies beyond youth, but certainly the data shows nationally that youth are particularly at risk for utilizing counterfeit pills and risk of overdose. But to date, there's been one.
One death from this new drug.
Correct.
So I'm saying, were we able to identify this person? Was it a homeless person? Was it the student? Like any information about this person who died due to the use of this new synthetic drug?
Yeah, so I think I said this when we first announced that as the health department and for patient privacy, we cannot talk about the details of this case. What we can note is it is a youth, and I would defer questions about the specifics to the Office of the Chief Medical Examiner. But from a health department standpoint for patient privacy, we are not at liberty to release more details about the individual. Hi.
So these synthetic opioids are being advertised likely as fentanyl or other.
Do you want to speak of it?
Or do they have street names? Like how are they being advertised?
Great question. Typically, counterfeit pills are advertised to look like and to be sold under the same name as prescription drugs. So usually they may be Xanax, Adderall, oxycodone are common ones, and they're often pressed to look identical, even though they may contain a variety of substances. So we don't always know if they're marketed as something else, but often they're trying to look like a regular prescription pill.
And in terms of talking with educators and parents, like what are your recommendations for parents who might hear this to really be candid in talking to their kids about what to look for, the social media element, buying them on Snapchat, things like that?
Definitely. I think the big message is nothing is safe, not even one pill. You do not know what's in it, no matter who you get it from, unless it's prescribed directly for you by someone that has seen you, by your doctor, a trusted source. We really encourage, we don't want the only source of information to be from social media. And so really encourage parents to engage in conversations about pills, about drug use. Often youth think that drug use is common and not harmful, so certainly talking about the reality that it is rare that these drugs are used and they're incredibly dangerous. And if you or a friend are worried or starting to engage in drug use, there is help and support, and we can get you connected to some of our prevention programs. We do have programs that work with families who are have youth in their life or their children are at risk of developing addiction or may be in that early stages of drug use, that can really work on skills building and socialization skills to prevent and reduce the risk of developing a substance use disorder.
Do you know what drugs were involved in the overdose deaths that are indicated in this release?
Yeah, so it's the report every month shows kind of the distribution of what compounds were identified, and so we continue to see high prevalence of fentanyl, and we do see prevalence of methamphetamine stimulants. It's not that one causes it, but these are what the Office of the Chief Medical Examiner finds in the decedent. And so, again, fentanyl continues to be the single biggest challenge we have here in San Francisco. And we have individuals that use stimulants, so methamphetamine, different than fentanyl.
So some experts suggest that efforts to crack down on fentanyl may be changing the illicit drug market. Do you think those efforts have led to a greater use of counterfeit pills, and how is the city preparing to respond to the public health challenges that may come with that shift?
Yeah, so I don't want to speculate about things I don't have concrete data. The health department must be grounded in where we have concrete data and evidence. I would say a few things. One, our focus is the best way to help folks prevent an overdose and an overdose death is to help people be connected quickly into a range of treatment options. And I want to emphasize the work that we've talked about in this setting multiple times around access at all hours of the day to some of the medications for someone using fentanyl. That not only helps someone stop using fentanyl, but it is one of the best things to prevent risk of an actual overdose if someone were using fentanyl. I think separately on this counterfeit pill piece, I want to know part of why we've been holding discussions with educators and kind of the health alert and the message to parents is we know both from the one decedent here in San Francisco, as well as national data, disproportionately youth are more likely, including youth that are experimenting and have not used other pieces, to go online, see something on social media and order a counterfeit pill. And so that is a slightly different audience, not exclusively, but we are wanting to make sure parents, families, caregivers, educators, schools can be having these discussions with youth who may be starting to experiment with these things and that they really understand the risks here. Thank you, Natalia. Oh, sorry, did I miss?
Oh, okay. I have a follow-up to my previous question. The clinicians that you do have at the Reset Center, are they certified to dispense methadone to help with withdrawal symptoms? And if not, is methadone provided some other way?
So methadone can only be dispensed in certain regulated settings, of which we have a set here in the city, including at San Francisco General Hospital, and a set of what's called OTPs throughout the city. And so the Reset Center, nor many clinics are not those. We have been facilitating direct connections. The same is true across any one of our settings. If someone raises their hand and is willing to start methadone or buprenorphine, our goal is to get them there as quickly as possible. We can help transport them directly from Reset. Again, we don't run the Reset Center. We are supporting connections to treatment and care and case management on the back end. And so we can provide that transportation directly to methadone, just like we were trying to do more of across the community.
Okay, last question. I noticed the new drug is much stronger than fentanyl. It's 10 times something like that. So can you tell me more about this drug, like how you can test it? And for the Narcan, is this like you have to double that dose or something like that for emergency use?
Dr. Soran?
Excellent question. Yes, these are roughly 10 times more potent than fentanyl. And the reason we're really raising the alert is because they are new. They are not picked up by fentanyl test strips, so that will not detect them. Narcan and naloxone is effective against these opioids. Still continue to use naloxone. Our guidance on how to use it and how much is still the same. If you're worried about an overdose, use naloxone, call 911. If someone has not responded, give another dose. All of that remains the same.
Thank you. Okay. Thank you, everybody, for the time. Appreciate it.